If you've used sound to get relief from your tinnitus ringing in the ears, you might just be doing it wrong. I get it, tinnitus can be annoying. Maybe you've played with noise or masking sounds for weeks or months, and yet nothing really has changed. You still have the persistent sound in your ears or your head. So how long does it actually take for sound therapy to work? What's the correct way to use it? And is it possible to use it too much? Hi, I'm Dr. Ben Thompson, audiologist and founder of Treble Health. Today I'm breaking down how to use sound therapy the right way, including how many hours per day you should use it, what sounds work the best, and the key mistakes to avoid. We have over 150,000 subscribers on YouTube because you guys trust us to provide evidence-based tinnitus treatment information. So let's get into it. First, at its core, sound therapy is about retraining your brain to tune out tinnitus. And there are two ways that this works. Number one is it provides immediate relief. So having sounds going on that are underneath your tinnitus, it masks the ringing sound and it makes the tinnitus less noticeable in the moment. The second benefit, the hidden key benefit that I want you to understand, is that consistent sound therapy over a treatment window can have long-term retraining for your tinnitus. That means over time, your brain learns to ignore the tinnitus, reduce the sound through a cognitive process called habituation. So how exactly can you use sound therapy? Well, you could use sound machines like this one right here, other white noise generators. You could use apps like Spotify or YouTube that have sound therapies you can play on there for hours, or you can even use medical devices like these from my team at Treble Health that sit up and behind the ear. But here's the key. You have to use it correctly to see results, whatever you're using for your sound therapy. Most people either don't know how to use sound therapy or they don't use it for long enough. The biggest error I see is when patients look to treat tinnitus using sound therapy with headphones or AirPods that block their ear canals. The brain needs to hear natural ambient sound. What I see with my patients is that keeping their ear canals open is a far better strategy. So instead of using AirPods like this in your ear that completely blocks your hearing, you instead should use a sound machine or proper sound therapy medical devices that don't block your ear canals, and you'll get the best results. I see this all the time with my patients, and they say, no, wait, but these AirPods, they have transparency mode. I can hear the world around me. Guys, trust me, it's not the same. So get it right. Try to keep your ear canals open so you can still hear ambient sound around you. Let's bring in the research. A 2022 study found that patients who listened to sound therapy for between 3 and 5 hours per day reported significantly greater relief than those who only used it for an hour. Another 2018 study showed that 72% of patients experienced tinnitus improvement after just 30 minutes of high-frequency sound therapy daily. So what does this tell us? More exposure with sound therapy means better long-term results. Even small amounts of time using sound therapy helps, but consistency is key. If you're only using sound therapy for a few minutes here and there, it may not be enough to make a real difference. This is the biggest question I get from patients. How long before I start to notice improvement? And will my tinnitus ever go away? Well, you will notice improvement, but it depends on exactly when, and your tinnitus can get significantly better and reduce in volume. Here are some important factors to consider. What is the cause and severity of your tinnitus? How consistently are you using sound therapy? And are you using any other tinnitus treatment techniques? What I see with my patients is that most people notice an improvement within 4 weeks of consistent use of sound therapy. My mentor, Dr. Powell Jastroboff, taught me that in certain cases, sound therapy can take up to 3 months before the brain starts to reduce the perception of tinnitus. And for the maximum reduction, the treatment window can take more than 12 months for full habituation. So be patient, and remember, sound therapy set softer than your tinnitus volume can provide quick relief. But the real goal is to retrain your brain, which takes weeks to months. Can you overdo it using too much sound therapy? Let's say my patient, they might ask me, Dr. Ben, I'm using the devices on my ears. I'm using them all day. Is that a problem? Not really, but there's a right way to do it. So here's what I want you to know. Your sound therapy should always be slightly quieter or softer than your tinnitus. If the sound therapy is too loud, your brain won't learn to adapt to the tinnitus. It's just like replacing one sound with another. If you have the right kind of sound, like a white noise, a pink noise, or an approved sound from your audiologist coming in through devices in your ears, then no, there's no maximum amount of time you can use sound therapy. If you're using a sound machine or another type of device, then similarly, there's no negative effects that have been cited in the research and peer-reviewed to be legitimate on long-term negative effects of sound therapy. We just don't see it. Just make sure it's a soft volume underneath your tinnitus and you're all set. Now a little pop quiz. Is it okay to use closed ear headphones all day for sound therapy? The answer is no. I don't recommend that. I don't see that working for most patients. If you had to use these kinds of devices, let's say this was the only thing within your budget, I would prefer bone conduction headphones or a sound machine like this, as opposed to AirPods or something blocking your ears like headphones. I want you to hear natural ambient sound around you, not complete isolation of closing your ears. And if you use sound therapy all day, what some people report is that they need another type of sound, what I call a variety sound, to mix up the sound therapy. Different frequencies and sound types can help your brain process tinnitus differently over time. And some of our popular sounds here on our YouTube channel are shimmer and crickets. Those are perfect for some variety sounds because if, for example, white noise or pink noise became somewhat boring at times, you could shift into one of these more variety sounds like shimmer or crickets, which we'll link in the description below. Inside of our medical devices, many of our patients prefer sounds like blossom or autumn. These are custom sounds that are inside of the devices that we use that are built by the manufacturer specifically for tinnitus. So this is the device. I thought I would just show you how this looks a little up close. So right here, this rubber tip goes inside of the ear canal. It has some natural holes in it, so the patient will not block their ear canals. They can still hear the ambient natural sound around them. Very effective. Then you have this wire, this piece right here. This goes alongside the skin, and then this piece up and behind the ear. This is the actual device. So this plays the sound therapy. So these work very well for someone who either just has a tinnitus problem, or they can also be programmed and set up as hearing aids for someone who has a tinnitus problem and they're noticing some difficulty hearing voices or understanding people in background noise. So I want you to find out what works for you. That could be the type of device as well as the type of sound. Let's now summarize what we've gone through in this video. First, aim for at least 3 to 5 hours per day of sound therapy for the best results. Second, be consistent. Habituation typically takes months, not days. Third, set the sound therapy volume softer than your tinnitus. It should never fully mask your tinnitus. Fourth, don't isolate yourself. Let natural environmental sounds play a role too, like opening your window or having on background music. Natural sounds are okay. You don't have to listen to sound therapy in isolation in a quiet place. It's passive, meaning just have it on in the background. You don't need to pay attention to it. And if you want to speed up your results, working with a tinnitus specialist can make a huge difference. T. Ward on Trustpilot said, "After a year with Treble Health, I am now able to live undisturbed by my tinnitus. I've successfully habituated even when life felt too daunting." Guys, the reality is tinnitus can improve and you can train your brain to ignore it. But you need to be consistent with sound therapy and use it the right way. If you're looking to try something right now to get relief, I would check out the Tinnitus Quiz. It's an online assessment I made to guide you on the next best steps for your tinnitus treatment. You can check the link on the screen or go to tinnitusquiz.com. And if you found this video helpful, you'll love my next video where I compare tinnitus retraining therapy with linear bimodal stimulation. Click here to check it out. I love you guys. Bye.